And then what are the other points? Yes, one point was that can we skip the lecture and watch directly from the YouTube? You can. You can. No one is forcing you. But it's like whenever there is, say, interaction. So if in case if you got any doubt, you can ask straight away. Use YouTube as a backup. Yes, good morning and happy Janmashtami to you too. Use YouTube as a backup. In case if the lecture is missed, so then you take it from there. Right? Not as a prime resource. Notes will remain same. Yes, just a note. Let me turn the chat on. Keep it on this next screen. Two minutes and we'll start. See, the idea is only one.
Morning.
Good morning. So that in the medical, you don't have to cram. But that's the only idea. You understand the thing so that rest of the journey becomes easy. Physiology will be starting after some time. That's why my intention was to, if the number increases now, then there is some motivation. Ke chalo, theek hai. Instead of 3 days a week, we take it 4 days a week. I usually keep a count. So previously it was 400 plus, dropped to less. Now to see, it's almost, we are about to start and the number has not crossed even 100. ठीक है. Oh, I got those emails. Long weekend, so you prefer to sleep for more number of hours. But यार 10 बजे अभी थोड़ा ना सोते हैं. By the way, how many of you wake up before, say, 5:30?
Yes, sir.
Yes, sir.
Yes, sir.
Quite nice. And before 5? Before 5?
Only if there is revision too.
That's I don't know if I told you or not. From 4 to 5, there is secretion of pineal gland. Pineal gland, it is one of the very important endocrine gland of our body, of our brain. Right? Pineal, because its size is very small. It is like pea, matar ka dana. Right? It is very small. But the secretions which it is releasing, they are very, very powerful. It is also considered as one of the very important secretion for anti-aging. Right? So that's why it is said the Brahma Muhurat. Why they say you wake up early, sleep early, wake up early. Between 4 to 5, now this is a even medically proven fact. Between 4 to 5, you wake up, you do some work even in your diary, you just write down that 1, 2, 3. ये 3 काम आज करने हैं, that's it. And then you go back to sleep. Wake up at 5:30 or 6 o'clock. But 4 से 5 में एक बार तो जाग ही जाओ. And do this much work. After 3 or 4 days, you'll feel like chalna yaar, chhod, ab kya sona, right? And you'll start your day. Try it once. So on to our topic of muscles. Very important topic. So here is how the body is. From cells combine to make tissue, tissues combine to make organs combine to make the system, and system is what is carrying out specific body function. Correct? Specific body function. So as we are discussing general, so it is like we are talking about the tissues. In tissues, we'll be having, say, epithelium, that is skin. Then there is connective tissue. There are various types of connective tissue in the form of bone, which we have discussed, cartilage, which we have discussed. Today we'll be talking about muscles. There are nerves. Right? So all these are various types of tissues which are carrying different functions. Because this was asked in the last batch. That's why it is been written over here. Whenever things go wrong, cancer is what? Cancer, when we say cancer, there is a beautiful system of controlled growth. In our entire body, there is a controlled growth so that the bone is always remaining in that shape, right? Skull remains in that shape. If the tissues they are getting destroyed, then new are generating at the same pace and maintaining that shape, size, pattern, function, etc. Cancer is, it is like an intruder. It is like an intruder, koi ajnabi. He has entered, right? Now this intruder is utilizing all the resources. It is using all the resources, but it is not doing any function. Maybe this intruder is weak. Maybe this intruder is immature. So it is basically abnormal, immature cells. They are, but the only point is their number increasing in number. The number is very high. So that's why that is they are called as intruder. When they come, they don't do any function, but they eat resources. But at what cost? At the cost of our normal cells. So that's when the body starts breaking. So when it occurs in skin, so it is called as the carcinoma, right? When in connective tissue, so if it is bone, so we call it osteosarcoma. When it is cartilage, so we call it chondrosarcoma, right? When it is in muscles, so it is called as myosarcoma. In pathology, we'll be learning it more in detail, but still if you want to go for it, then there are two types of muscles. One, what is called as the skeletal muscle, or also called as the striated muscle, right? In which it looks like as if there are lines. Today we'll be understanding why the striated, why it is called striated. What lines we really see, right? So that would be called as the rhabdomyosarcoma. That means it is the cancer of skeletal muscle. When it is smooth muscle, right? So, for example, intestines, then it is called as the leiomyosarcoma. That means muscles of the intestine or the smooth muscles of the intestine, they are now in the firing line. So that is what is called as the leiomyosarcoma. For now, the conditions are totally different. So we will not be talking about it. This is increasing muscle mass and decreasing fat, right? This should be your primary gain. So there are machines available, right? Very cheap. Right? They just measure the muscle mass and the fat and even the visceral fat. So whenever you do any of the exercise, why it is like you evaluate yourself every week, right? Evaluate yourself every week and weigh yourself every day. This is for, say, as I said, that we are not taking right now a separate fitness session. So that's why, because muscle is related to fitness. So time to time, whenever the important points would come, I'll keep on mentioning over here. So this would be a sort of a fitness session also. Right? But do keep in mind, you have to evaluate yourself every week, but weigh yourself every day. This is one of the method of losing weight. Because every day when you'll watch, then even on one day, if if you have consumed any kachra, the next day, that when it will show that yes, the weight has increased, you won't feel like touching it. Right? So it's important. So here it is: increased muscle mass, there is decreased fat. That's the primary function. When the muscle mass increases, so its efficiency increases. Why do we say its efficiency increases? I mean, when the muscle becomes big, we'll get the answer today. We'll get the scientific answer today, right? So why it is like, because muscle is not the new muscle is developing. It is the same muscle which is becoming bigger, right? So that is increasing in muscle mass and why it increases efficiency. We'll see that. Yeah, 40% is good. Okay. The word came from this muscle. It came from the word musculus. Musculus in Greek, it means mouse. So, well, it makes sense that it looks like mouse because this is like belly of the muscle and this is tendon of the muscle. So it looks like mouse. So that's why in medical, musculus is muscle, but its literal meaning is mouse. Now, same thing in IT. In IT, what we use is we say that, okay, this is the mouse, right? But why they do call it a mouse? Because way back there was a fight between Still, it is there between Apple and Microsoft. Right? Apple tells that we are much powerful, much safer, and that is true also. Microsoft, yes, they say we have made things more cheaper. And in AI, so the war is amazing. You must have noticed also those who are using Apple. Apple came with what's called as the Apple Intelligence, and it was a huge failure, right? Apple Intelligence. It was a huge failure. People say that Apple took so much of time and still it's not working, it's hanging, this is that. Microsoft, that Copilot and everything, right? That function. So that is working beautifully. Every other company has come up. Then ChatGPT version 5.0 has come. That is so powerful, so amazing. Its voice function, right? That is so good. Means even in free version, you get such a wonderful voice. And but what Apple has done is Apple has integrated everything. So irrespective of that, that is what is called as the intelligence agent. Which agent would you use? Because there are several agents. So for specific function, there is a specific agent. What Apple did is they said that why to put this burden on the user? User need not worry about whether he has to use the route LLM or he has to use the Copilot or he has to use the ChatGPT, which version, or he has to use the nano version because it is costing less, but the processing is less also because the question is so simple. The point is what Apple did, and it is coming up, right? It it said that it will be using everything, but without telling the user. So it's like if you want to go to buy vegetables, so automatically your bike will come in front of you. If you want to go for some big meeting, right? So then automatically your car will come in front of you. You don't have to select which vehicle you have to use, right? And in your inventory, you've got all the vehicles, all the way from cycle to Rolls Royce. So that is what is called as the Apple Intelligence. So it was expected in the market that Apple will definitely come up with something so unique. So this is the for all the emails regarding one that the PDF is not showing, right? uh, because everyone else is able to watch it. I'll say Sumatra PDF, right? Sumatra PDF. Try to use this software. You should be able to use it. This is free and easily you'll be able to open it. Because some of the files which I'll be sending you later for the studies, they are like EPUB. Right? So this software can open even those files. So there should not be any problem. Regarding this B12 and D3, we have discussed several times the dose. So same dose which you have to follow. In case if it is extremely less, in case the B12 is less than 100, so then you have to go for injectables. There is no other alternative. Or if the D3 level is dangerously low, that is below 5. Right? There was just one case till now whose D3 was less than 5. But I have replied to that. I'm not against upvas. Upvas, that is not eating and keeping the fast, that is good. Right? No doubt about it, but not every day. The value of that fast is when you do it once a week or once every fortnight. Coming back to this, so that fight between Apple and Microsoft, Apple came up with one device and they called that device as the mouse. They said with the help of mouse, you'll be able to perform much better onto the screen, and that's why they named it as Macintosh operated user system enhancement. The system which user is using, that would be enhanced. He'll be able to perform better functions, and this thing would be Macintosh operated. Mac is Macintosh, so that's why it was called as the mouse. Later on, Microsoft, after about 1.5 years, Microsoft adopted this system and very smartly, they said now it is Microsoft operated user system enhancement, right? But this is original. Original is Macintosh operated. Same way, this example is also like that. DNS, when we say DNS, so in medical, we say deviated nasal septum, deviated nasal septum. So this is the nose, and in between there is septum. Both the sides they should be same. But if someone is snoring very much, or if someone is having trouble breathing, so then on investigation it is found that this septum, if it is deviated, so our nostrils they work step by step, right? First left, then right, then after some time left. So it transits from left to right, right to left. So when it is via this nostril, so then air, sufficient amount is air is going. When it is via this, the person feels breathless. And this is what is called as the deviated nasal septum. It can occur even by injury also. Kisi ne punch mara, right? And the septum broke and septum shifted. So all those things are also possible. And in IT, it is called as the domain name services. Domain name services is that is when you say www.cisco.com or Microsoft.com. So then how is it deciphered? Because everything runs by what's called as the IP address, right? IP address, which are two types, IPv4 and IPv6, right? IPv6. So these are like a signature code on which you send a mail and it reaches exactly to that point. Right? So this is the 32-bit system, very old system, but 32-bit in which there were millions and millions of IP addresses, but all of them, they are exhausted. So that's why there came the new system, which is based on IPv6, right? It is called as the hexadecimal system. So this is on binary. Binary is only 0 and 1. We are using decimal system. So 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, right? So total 10 digit. That's why it is called as decimal system. Deca. Deca is 10. While in this IPv6, it is hexadecimal. Hexa means it is 6 plus 10, that is 16. So over here, it is all the way, it will go from 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, and then A, B, C, D, E, and F. These are the extra, and that's how it goes. And this system is 128-bit. So that means even up to 2000, that is for your entire life, you don't have to worry about, because till the year 2020 to 2100, right? Even after 75 years, there'll be few billion IP addresses. They will be left as it is when every human on this earth is using more than 10,000 IP addresses. Right? Now you might feel like that 10,000 itne to apne kahan use karte hain. But say for example, if you are using Alexa, if you are using Siri, right? If you are using any of those, so IP addresses, so they are getting allocated to every of your device individually, right? Even your routers. That's okay. They are private IP addresses and there are some public IP addresses. But the thing is, all the IoTs, Internet of Things. So say for example, washing machine starts itself, right? You can control your microwave. You can control the lighting system of the house. All those things, even remotely when you are doing this, all are the IoTs. So in such cases, it will be starting. And the DNS is, you don't have to remember such complex IP address. You have to just remember www.youtube, right? That's it. That's the only thing which you have to remember. And that's how the DNS function. So DNS function is IP address, which is mapped to the friendly name. Right? So this was bit of our IT class. So back to our body, muscles, they are like motors. Joints, they are like gear system. Nerves, that is like electrical system. Brain, that is a command center. It's like supercomputer. Skin, eyes, ears, right? All those touch sensation, they are like sensors. They'll be sending the information. And larynx is like a sound box, right? So our human system will be understanding it in this way only. So when we talk about this actin myosin, so this is like a combination of a very romantic couple, and we'll see how extraordinary it is when they work together, how they increase the efficiency. So total number of muscles 620 to 640. Many of the muscles are variable. This is one of the examples. Say, for example, it is palmaris longus. So palmaris longus, that is a muscle, definitely there. But when you dissect, it is not necessary that in every case you'll be getting it. In some cases, it will be very prominent, big belly. In some cases, the belly is very thin. In some cases, it is only a thin strip. And in many of the cases, you might find it that it is absent. right? So there are some variable muscles, but it is interesting to know some things like strongest is the masseter, right? The masseter, which is for chewing, it is the strongest muscle. The longest muscle, this is sartorius. It is also called as the talar muscle. This is the muscle of thigh. Right? This is the muscle of thigh. Very, very powerful, very long muscle, 18 inches. And this is the biggest muscle, that is the gluteus maximus in the hip region. This is the muscle which gives the round shape of the hips. There are three muscles: gluteus medius, gluteus maximus, and the deepest one is the gluteus minimus. So minimus is smaller, medius is bigger, maximus is largest. So here is the concept of fitness. When you do any of the exercise, whether it is running, whether it is weightlifting, any of the exercise, uh-huh. I'll answer to these just in a minute. So exercise, that is like a micro injury. Whether you go for a long walk, run, or weightlifting, yes, this micro injury varies, but definitely there is some injury. But when you rest, so then and massage, so it heals. When you just press, even when you press your muscles, right, it is as good as massage, which is increasing the circulation. In some Garmin watches, you'll find, say, in Garmin watches, there is one component which is called as the recovery time. Recovery time. Just excuse me for a second. I'll be back. Just. Yeah. So whenever there is any exercise, right, it will give you the recovery time. So if you walk for shorter distance, the recovery will be like it will be showing 6 hours. So even a 6 hours of rest, and you are back to the system for your next exercise. But if it is heavy, say for example, if you run marathon, so straight away after completion of marathon, as soon as you just stop, and then you'll find the recovery time 36 hours. So depending upon the load, it would calculate. So that's what is needed for the proper exercise. When you ask some of the question that you are exercising 5 times a week, I won't be able to answer it properly whether you are doing it right or not, because it depends upon what exercise are you doing. But yes, if it is in general, if it is like upper body, say lower body, upper body, lower body, right? So then it is fine. Abs, you can do daily. You can do daily because the muscle size is very big and they don't get fatigued that easily. Right? So you can go for abs daily. Core, core muscles, ideally, you should really do it daily because they are deeper muscles. Even if you try to do more exercise, other muscles would be fatigued. The effect on core, that would be very light. So that's why whenever you do the plank, right? Plank, that is wonderful exercise. Do the plank every day. Now that you've got good phones, start it, right, with a clock. Say, for example, on the first day, you are able to hold it, say, 45 seconds, right? 45, or even if it is less, no worries. Next day, try to increase it by just 1 second, just 1 second. And see how effectively you improve. Right? There would be a stage when you'll say no, अब 1 second भी नहीं बढ़ेगा. No problem. Let's say it is 1 minute and 7 seconds. ठीक है. Every day, try to reach to that point. Gradually, the muscles will become stronger and you'll be able to pull it further. Right?
Sir, I started doing plank 2 years ago, and
Ah.
now I can do at least for 2 minutes.
Ishan, I should say that send a mail to me because in this much time frame, you should be able to reach it at much higher level. I do
Okay.
plank for my maximum. It was on sharp. Normally, I can pull it till 4 minutes, but it was the record is 4 minutes and 17 seconds. That is the highest. But it was on sharp. The last 17 seconds to chilla raha tha. But
Like I do it for 3 sets for 2 minutes.
huh. Well, I'll show you a method by which you can increase your performance. And it is not only this, right? If you want to increase, so you just go for this, then this, and once again you go on your elbows, and once again you go on your palms, do this, and then once again go on elbows. If you follow this routine very quickly, your psoas major and psoas minor, these are the muscles which are inside, which are connected with the spine, they'll start coming into picture. So your back and
Okay.
your core, they'll become more powerful. And if you are in running, then see the improvement in the performance.
Okay, sir. Thank you.
Any query, just let me know, because 2 minute plank is good, but it should improve. Since how long it is plateau is at 2 only?
Since a year, I think. But now I can a little bit improve. Like I have joined the gym 4 months ago.
Uh,
So now I can do at least 3 4 minutes. Stuff.
Plank,
Yeah.
test it.
Okay.
Because 2 into 3 doesn't mean that person can do the plank for 4 minutes, because it is single shot. When you do it single shot, the most difficult phase is from 3 minute to 4 minute. It took me 6 months to reach to 4 minute. So yeah, but there is always a scope of improvement. Good. Back to this. So muscles, they have got the property of one, what is called as the excitability. Excitability is very simple, Sichi. This is the wire, right? That is the nerve, electric wire, sending the current, and the muscle twitches, muscle contracts. So that is excitability. This excitability, this in physiology will be studying that if the current is weak, muscle might not move. So you need certain current so that muscle starts contracting. So what is the mechanism behind it? Is behind all these things. That is what we'll be studying in physiology. Then comes the contractility, what we talked about, right? Muscle will shorten, right? It will contract. Extensibility. Muscle has got the capability to stretch beyond its limit. And then there is elasticity. Contractility and extensibility, they both are in reverse direction. In one case, muscle is getting shortened. In other case, it is getting elongated, but it is not losing the elasticity. That means if you don't do anything, muscle will come back to its normal original position. This is crucial. This is what is needed. So so in say fitness, keep this thing in mind. American College of Sports Medicine. And this is American College of Sports Medicine. This is equivalent to you are doing a post graduation in fitness. This is that difficult the courses, and the exam it is conducted by this institute, American College of Sports Medicine. None of the instructors in even very good gyms, they are having any idea of this ACSM. Right? This requires, I mean, not only the understanding, but you have to really work hard to get this degree. But it is so good. And I feel like as such medical to aapko padhna hi hai. This, if you do it, so not for anyone else, but even for yours, you'll be learning all the fundamental things about what should really be done for your own body. Right. And this includes everything. It includes everything in the form of mental fitness, physical fitness, sexual fitness, right? Everything is part of it. And then if someone is interested, so then they go for rehabilitation, and then for the cancer patients about how to handle them. So that's a completely different thing. But we'll talk about this. But this is very interesting. Huh. So elasticity, right? So breathing, locomotion, heat production, posture, all these are functions of muscles, right? Breathing, though it is automatic, locomotion, movement, heat production, right? When person shivers, so basically it is nothing but production of heat. For the posture, and it assists in venous return. Venous return. When you run, you start getting pain in the calf muscles, right? Because muscles are short and their function is extensive. Calf muscle, to be very specific, soleus. There are two muscles, gastrocnemius and soleus. Gastrocnemius, there are two heads, medial and lateral head. So that muscle is like this. That muscle is like this. It is this muscle which actually gives shape to your calf muscle. Right? So that is the gastrocnemius. But there is one important muscle which is sitting inside, and that is called as the soleus, which is also called as the second heart. It is this soleus muscle. When the blood comes, its soleus contracts and it pushes that blood back. Because the blood, when it is coming by artery. Right? Blood is coming by artery. But this blood should be pushed back by the veins. If veins are not capable of, so then that will lead to varicose veins because veins will become tortuous. पीछे से धक्का मार रहे हैं, veins is unable to push it. So veins, they will become tortuous. And that is what is called as the varicose veins because they start emerging. They become so prominent that you can watch it on the skin. So that is, and it is very painful. Commonly seen in policemen, traffic police wale. Now, traffic policemen, see, one, they don't do exercise. Second, they eat, they drink, and सबसे important, they stand for long number of hours. Now, during that time, even the dehydration is occurring, the quality of the food is so bad. So all these things lead to collagen damage. And venous return is not proper, not doing exercise. So that's why when you are traveling, and you're traveling by air, right? The, the chances of venous congestion that becomes very high. Have you noticed family member में या किसी में when they travel तो जैसे कि पाँव ऐसे फूल जाते हैं इतनी सूजन आ जाती है right they
Yes.
those ankles they become so big unable to see any veins all this is that is a clear indication that their soleus is not working fine. So what you have to do is at this age so that nothing goes wrong when you are say 50 60 70 right even 100 कुछ भी नहीं कोई प्रॉब्लम नहीं कॉन्ट्रैक्ट योर काफ मसल्स सो जो आपका जो नी है नी जॉइंट राइट वहां से मेक इट अप so that your leg this is on your toes and then down so up down if you do it even for 5 times in 1 hour or 1.5 hour that is enough for the venous return to stay in a better shape. इसलिए ज्यादा कभी बैठे भी मत रहो से फॉर एग्जांपल you worked for you're sitting for 1.5 hour so after that थोड़ा बहुत जंप कर लो just jump walk on toes so that would be enough.
Sir, is feet twitching related to the same thing?
Which
Like
one?
the up feet twitches, right? The
Which
up
is
down.
true twitching is then the muscle is crying कि बेटा इतना torture किया है so now it is trying to say get the oxygen but it is not coming up right so it is unable to perform because what oxygen when the blood supply is proper it is getting oxygen it is getting ATPs and then it is working fine but when the blood is insufficient so you see it in marathon they are running and then suddenly the muscle goes into spasm it goes into the spasm because now there is no nutrient no micronutrients available which can really relax it.
Mm-hmm.
So when they say कि exercise is one thing but at the same time the nutrition what you are taking and it varies from person to person. Say if you are a heavy sweater to the amount of sodium and potassium which you will be losing that would be extensive. So if you don't fulfill that nothing would happen when you are doing exercise in the gym. Treadmill पे आपने 10 किलोमीटर दौड़ लिया. The moment you come on the road there are so many other factors which are working out right and then the muscle goes into spasm. When the muscle goes into spasm, he cannot move even for 5 feet. वहीं पे गिर जाते हैं.
Sir, twitching in the sense like you told the exercise, right? To move the knee up and down. The
Yes.
same movement or occurs autonomously sometimes.
But that is when you are doing it, say, under your wish. So you are doing it at full contraction, right? It is full contracting and then
Mm-hmm.
relaxing. While over here, the contraction is partial. It is partial. So it is not exercise. It is when the muscle is unable to respond properly. And that's why upar se brain message, there are continuous messages. Now there can be various reasons. The thing what is called as the convulsion. That is what we'll be discussing in neurology. When the brain is at fault, brain is firing, right, sending the signals. Now those signals, they are not strong enough to go for full contraction. So that contraction is minimal, right? When it becomes more,
Enough for shivering.
huh, huh. But then when it goes more, so then it is called a seizure. Seizures are various types of seizure. One, the entire body is contracting, or when it contracts and then it is not getting relaxed. Right, it is not getting relaxed. So all various types of seizures, grand mal, petit mal, they are all different type of seizures. Seizure means convulsion. जो हिंदी में कहते हैं वो खींच आती है, right? So that is, and it is very powerful. And when the person dies, then that is called as the rigor mortis. Rigor mortis is, say, those soldiers, those who die in action. So during that, when they are firing, so right, they are so active, the body is heated up, temperature is high, and then someone took the headshot. Now all the ATPs and everything whatsoever over there, right? They were there, they contracted the muscle, but then there is no other blood supply which is sending to relax it. So after some time, there is development of what is called as the rigor mortis. Rigor mortis. That is when the body starts getting contracted. And then if you try to open it, the muscle would break, but you won't be able to open it. Right? It is called as rigor mortis. It is one of the forensic medicine sign by which just from the touch you can judge death occurred before what time. Right? So that is what is called as the rigor mortis. There was one very beautiful, means that movie was very nice and very sensible, and people kept on asking what happened. मतलब वो मर क्यों गया? In two lines, if I say the movie, right, one person was planning to kill the wife, and finally he was successful, right? Murdered her, took the dead body, कार में बीच पे ले जाके कार खड़ी की, body निकाला, right? And then he reached deep into the ocean, the point from where the ocean was actually very deep. And when he tried to throw her back, right? He was unable to because the muscles, they were contracted, and she was like this, hugging him so tightly. So then obviously the movie hai, right? कि मैं कभी तुम्हें छोड़ूंगी नहीं. So that was that last line. And then a big wave came. It was rigor mortis, and she took him also into the ocean, and the end, right? But the whole movie was revolving around rigor mortis. रहने दो, लिखा है तो let it remain. अच्छा. So we now talk about types, what is called as the striated and the smooth muscles. Striated means यहाँ पे it looks like as if there are lines. So why there has to be lines, right? In striated, there are two types, skeletal and the cardiac, right? So let's move on to the skeletal muscle. Skeletal muscles, those who are under your control, they are voluntary. So limbs, tongue, larynx, esophagus, right? All the esophagus is partial. Only the upper third esophagus. After it crosses to that level, you cannot throw the food back, right? So all these muscles, their specialties, they do fatigue. Thak jate hain, these muscles, right? They do fatigue. However, in case of cardiac, you'll find that they have got one of the unique feature, which is called as the intercalated discs. So intercalated discs. So this is how they will be looking like. Some disc structure we'll see on histology also, under the microscope also. But these intercalated discs, they take to this important function, what is called as the gap junction. Gap junction is when everyone, like any of the covert operation, right? When all the commandos, they are given one control, one communication system. So it means if a message is given, it reaches to every commando at the same time. Same way over here, the gap junctions are the ions instead of passing or sent by the neurotransmitters and then the nerve is telling no, they internally communicate. So that's why the whole muscle it contracts together, right? The whole heart it contracts together. So this is the beauty of this interconnected disc, which are because of the gap junction. And these gap junction, they are for the instant passage of ions from one cell to another cell, from one myocardiocyte to another myocardiocyte. So that's why they contract together, and their specialty is they never fatigue. There is nothing like fatigue, because if they fatigue, heart stops, right? So that's the specialty of it. When it comes to smooth muscles, these muscles, they are the muscles which we find into digestive system, urogenital system, blood vessels. They also never fatigue, right? They also can keep on working on and on and on. The muscles which are under our control, right? Central nervous system. Central nervous system is the brain and the spinal cord, right? As such, we say spinal cord. But now we'll dive slightly into it. Spinal cord, whatsoever is coming out of the spinal cord is not all central nervous system. Right? The thing is that through the spinal cord, yes, it is the main lifeline, but from it, there would be many of the fibers for autonomic nervous system also, because finally, so everything has to reach to brain. So when through spinal cord, there'll be central nervous system, which is under your control, and the autonomic nervous system, the fibers. So from what is called as the lateral horn. So there would be anterior horn, right? Anterior horn, posterior horn, and the lateral horn. So from lateral horn, whatever the things which are coming out, they are all part of the autonomic nervous system, but they pass through the same spinal nerve. So that's why the nerves which will be coming out from the spinal cord will be calling it spinal nerve. So spinal nerve means it is coming out of the spinal cord, but it can be having multiple things, right? Just a minute. It's not understand. Sorry, that some renovation work is going on. So that is called as the spinal nerve, which will be a combination. Okay? So in ANS, autonomic nervous system, there is automaticity. Automaticity means no motivation needed. No motivation needed. For the heart to beat, there is no motivation needed, and that is what is called as the automaticity. So from automaticity means they'll be sending the pulse, right? Pulse starts from SA node, though it is under the control of brain, right? So brain can increase or decrease or make some changes. But SA node as such, right, it is called as the pacemaker. So it will keep on sending the signals for the whole life. From SA node, it will go to AV node. SA stands for sinoatrial, that is sinoatrial, that is from the atrial component, that is the area. Then to atrioventricular, the junction of atria and ventricle, that is the second station, AV node. AV node is very enthusiastic, but AV node is like, if I don't hear from SA node, then and then I'll start sending the signals. AV node sends the signals at a very slow pace. So in case if SA node goes wrong, so then AV node is continuing the heart, but it will be at a very slow pace. The pump, the power, that would decrease, but at least person would survive. So that's why SA node, it is the primary pacemaker. Then it goes to AV node. From AV node, it goes into the form of bundle of His, right? Bundle of His. So this is a group of nerves which are going down, and then all the way they are going into the form of Purkinje fibers, the fibers which are entering into the cardiac muscles, and then they are contracting. So that's how things they really go. There is one other system, what is called as the enteric. This is also part of the ANS only. It is called as the enteric nervous system. Enteric nervous system is also called as the second brain. The digestive system, the abdomen, right? Enteric system, that is in abdomen. So if a question is asked, can abdominal system think? Yes, it can think. In fact, your entire mood, it has been now medically also proven, it depends upon the enteric nervous system, because enteric nervous system is the only system which can secrete serotonin. Serotonin. And serotonin is vital for your mood, for your better mood. So if stomach पेट ठीक ना हो तो कभी मूड अच्छा रहता है नहीं, कहीं कहीं फोकस नहीं, कुछ नहीं, right? Serotonin, it is liberated, it is released, it is produced into the enteric nervous system via 10th cranial nerve, vagus. It reaches to the brain and then the action starts. Then the action starts. There is one method for autism, or for those kids, those who have got the obsessive compulsive disorder. Right? If you see they start eating, so they'll keep on eating. Kid is of 4 years, right? But eating 5 roti, 6 roti. Because if you try to stop them, they'll scream like anything. This is the trouble. Serotonin, because serotonin also generates that sense of satisfaction, right? Otherwise, lack of this, so that is what is called as second brain. And the word gut feeling, it came from that only. So during this section, during the study of abdomen, we'll be going deep into this. But at that point, when I'll be talking about enteric nervous system, do remember these words, that these are the areas. We'll find wonderful nuclei. So many nuclei. They are even, in fact, more than the brain. Yeah, 1.2 times than brain. So there must be some function, right? So enteric nervous system, still it is like a mystery, but now there's a second brain. These are our muscles, striated muscles, right? Or the skeletal muscles. Those skeletal muscles, they are multinucleated, rich blood supply because oxygen is needed, right? And they contract really very fast. When I say contract very fast, physiologically, there are two types of fibers. One is fast twitching, second is slow twitching. Right? Fast twitching, slow twitching. So both of them, they are, but it's more or less with respect to exercise, right? So we'll talk about it when we'll reach to that point. Over here, this is cardiac. They are uninucleated. They are uninucleated, right? They are rich in blood supply. And over here also, the contraction is pretty rapid, right? But it is very rhythmic. That's the specialty. It is very rhythmic because heart is like that. And over here, for the gut feeling, it is uninucleated. So it is easy to identify. The blood supply is less, so they'll appear whitish, right? And the contraction is slow because in digestive system or in any other system, no need to go for high-speed contractions, right? Over there, again, the rhythm is more important. Which rhythm? Peristalsis, right? Peristalsis, so that food moves at a convenient pace. Oh, so many messages. And emails also. Mother stands in kitchen for almost the whole day just to test it. Burpees, excellent exercise. Excellent exercise. Oily skin, pimples. Okay, smooth muscle contain visceral muscles too, or it's another name of smooth muscle. Viscera is organ. Good question, right? Viscera means organ. So the viscera, right? That means organ. So muscles of organ, go bolo, right? So whether that organ is digestive system, right? Stomach, intestine, liver, spleen, everywhere. They are the blood vessels. You get those muscles, right? Cardiac muscle, as such, so heart is also one of the organ, but it is special. So that's why it is the cardiac muscle that is completely separate because its physiology is different. So in muscles, there is a fleshy part, which is a soft part, which contracts, and then there is a fibrous part, which is non-contractile. So that makes the complete mouse, right? This is a fleshy part, and this one is the non-contractile, maybe say tendon part, right? This is flesh, right? And this is the fibrous part. So fibrous part is needed muscle to bone. When this fibrous part, it is cord-like, right? So then we call it tendon, cord or rope-like, straight. In most of the cases, you'll be watching tendons only, right? That tendon could be thicker, tendon could be thinner, but it will be like rope. But when it gets flattened, we call it aponeurosis. That's why tendon aponeurosis is what? Flattened tendon is the aponeurosis, right? So, for example, the biceps muscle is there. When it goes, so then there is a tendon of biceps. But then there would be like bicipital aponeurosis, means that tendon, it flattens and then it covers a big area. Right. So that is what is called as the bicipital aponeurosis. So immediately you find that yes, biceps, fleshy part, then there is a tendon, but that tendon wo khul ke aise fail gaya. So then that spread part, that is what is called as the aponeurosis. Aponeurosis function, muscle can attach to a wider area, right? So thus it will be having a big base for the pull. So such muscles, they'll be having enormous power. Now we dive into this. Starting from the muscle, right? So that's the muscle. That's our muscle. So this muscle, we are talking about the flashy part. So from this point onwards, everything is flashy. From above, this one is tendon. And then that tendon will go to any of the bone to attach. So here is a muscle. As we remove the layers, there are name of these layers, but we'll see it in next slide. But over here, first we peel that layer. And we find that there is one bundle, right? There is one bundle, and that is what is called as the fascicle. This bundle, which is comprising of so many bundles, right? So this was one complete bundle, which we are calling it muscle. We removed that layer. So we found that then there are small bundles into it. So that is what is called as the fascicle. So this is a fascicle, this is a fascicle, this is a fascicle, right? They all are separate, but they are fascicles, they are groups. We pull out one such fascicle. So this has been pulled out, right? So from muscle, we move now on to the fascicle. We remove the layer which is covering the fascicle. We find that it has got still more groups. All right. These are still more groups, right? So now every group will be calling it as myofibers. Okay? So we pull out one myofiber and we remove the cover of it. And we find that still there are more groups. So that group is called as the myofibrils. Right? They are myofibrils. That myofibril, when we see closely, we find that it has got something else. All some very delicate filaments. So we call that thing as the myofilaments. Right? So all the way, this is the muscle to fascicle to myofibers, to myofibrils, to myofilaments. And then these myofilaments, that's where our lovely couple is lying, actin and myosin. Right? Actin and myosin. Now today the things will be very romantic, right? Actin, myosin. But next time, right, again we'll be discussing the muscle and we'll get his Kharus Bhai, right? Who will prevent meeting of these two people. Right? And then starts the game and then see that how intelligent is she.
Troponin, right, sir?
Ah, बताए ना.
Okay.
Wait. Right? So these are the myo. From this point onwards, take out a fresh paper, right? Sorry. Take out a fresh paper. एक पेज पे सिर्फ एक ही फिगर बनाना और साथ बनाना, right? And if possible, take 2 or 3 colors of pen pencil. कुछ ना मिले तो एक pencil और एक ball pen. That would be sufficient. But it is necessary colors के साथ. And keep that paper always with you, right? 2 दिन तक आपकी यही है कि in next 10 days, in next 2 days, you should make that thing at least 10 times. कम से कम 10 बार देखे बगैर बना देना है. With complete labeling, right? क्या क्या label करना है? Everything I'll show. So here starts our journey. Before that, just let's finish this part. Muscle, we said let's remove the layer of the muscle, right? Layer which is covering the muscle. So that is called as the epimysium. So we remove the epimysium and we find there are fascicles, right? So here are fascicles, right? So we pull out one fascicle and then we find that there is some covering. That thing is called as the perimysium. Perimysium. So we peel off that perimysium and we find that there are still more groups, and they are called as the muscle fibers, right? So we pull one muscle fiber and then the covering, it is called as the endomysium, right? Endomysium. So these are the coverings. Why they are needed? One is insulin. When we say that muscles, right, we are not yet discussed it, but let's say it is like you are running a marathon. It's not so that the entire group of muscle will contract together and relax together. Brain knows that we are supposed to run for a longer distance. It is not necessary for us to go for a complete sprint. So that's why it will deploy a small group of muscles, right, which are needed for the contraction and you are moving. After certain time, some time, this is a completely automated function. You don't have to do anything. Just what is needed is the practice. When you do practice, so then brain knows that okay, now let me shift the batch. So this remains at rest, and then the other group it starts contracting. Inside only it is a completely automated system. Meantime, those muscles, those who are working, those muscle fibers, they now relax, they gain the ATP, they are now ready to fire. And when this group say goes into the fatigue, so they go into the refractory state and this group starts acting. Right? When the entire group, everyone is tired, that leads to what is called as the cramps, right? Spasm. And then it becomes more difficult. So we'll see also that what to do in such cases. But these are the three coverings. So insulin is needed, insulation, not insulin, sorry. Insulation, electrical separation of these groups so that when the brain fires, the brain would say, let's stimulate this group only. Don't talk to that other group. So they are contracting. So when it is like common cable, which is coming from the electric company, right? But we put on the central board, right? We put that this line will be going to bedroom, this line will be going to kitchen, this line will be going to drawing room. So that is where we are separating. But the line is common. And in that line, bedroom, one is going for the AC, one is going for the fan, light, this light, that light, all those things, right? So same style, right? Finally, they will come and meet. So it means that every fiber is getting controlled individually by the brain and it is sending the signal. When we'll be learning the nerves, we'll learn the nerve like, Arre, theek hai, chalo, this is radial, which is going, right? This is the ulnar nerve, which is going. But boss, in ulnar nerve, there are so many microfibers, right, which are individually controlling the entire system. The best example is face. On face, right, there are so many muscles. But the way you can express, you can talk about larynx, hai to itna sa, but it can speak so much, right, with so much of variation. So when you say, dheere se kar, there is one thing, right, and you jor say, arey, pay attention, right? So all those things, so then larynx, it has to work so much. And then brain has to think how much air is to be pushed from the lungs to generate that voice. And then ears will be listening to that, this sound is okay, right? So should I make any of the changes? So it is like a feedback phenomena. That's how the whole thing works. So in such cases, it is very much necessary to give a very fine control. That's the reason these all mycium, they are important. Endomycium, perimycium, and epimycium, they are important for this purpose, right? And it prevents bursting. Burst hote bhi hai muscle, right? When they go overboard, and then suddenly you'll find thirds, right? The pain is so bad, and then you'll find that within minutes there is huge swelling. So that is the muscle burst. Muscles, they do burst. But because they are covered by these nice coverings, so the chances of that muscle burst, that is very less. Unless and until someone abuses to a very bad level. So here is now about back to our couple. This is actin and myosin. Both of them, they are protein, right? Both of them, they are protein. From this point onwards, we'll remember it like M. M is for male, right? M is muscular. So here muscular means Muscular means its size is big. Pus, right? And actin is our female. So here it is. The first rule is that there is some protein, right? This is a protein. Whenever anything binds to it, there would be change in shape. Whenever anything binds, right? What binds, that will come. But rule is when any of the molecule binds, so there will be change in shape. And when that molecule unbinds, so it will return back to its original shape. So binding and unbinding, that process, it keeps on working through and through. So this binding leads to change in shape. When that binding is removed, so it will come back to original. Right? So that's the principle of elasticity, when it can come back to original state. So from here, we have to draw. Yes. So first, what you'll draw is, you'll draw this male, right? Myosin, right? Draw myosin, 1, then this 2, and then this 3. Keep some space. So when you say myosin, right? This is myosin. It is thick, right? It is thick, and the symbol of male. Thick. Now we'll introduce. Yes, want to ask anything? Fast.
There is this diagram of contracted muscle.
Don't worry about it, whether it is contracted or not contracted. Okay? We'll automatically see it.
Oh.
Achha. So then draw these thin lines like this. So that is actin. Actin is thin. All right. And to all of them, just connect it with the zigzag line. Zigzag line. So this is, I'm giving the number. This is number 1. This is number 2. And this line is number 3. We'll draw it in this order only. What we have really drawn is, it is called as the sarcomere. From one Z line to another Z line, it is called as the sarcomere. Sarcomere is the functional unit. So every sarcomere will be working independently, right? So that's the sarcomere, in which in between there is myosin, and then the actins, they are placed, and all actins, they are connected by the Z line. Okay? This is now the basic thing. Sarcomere, because mere means piece, sarco means muscle, so it is a piece of muscle. Very sensible, right? How thoughtful that it is called a sarcomere, or the piece of muscle. Also, can we say sarcomere is between 2 Z lines? Yeah, very easily, right? Very clear. It is between 2 Z lines. And a German scientist called Vishwa, right? He said that these are nothing but the intermediate discs. True, because this is one sarcomere. Another sarcomere will also be connected, right, with it. So over here, like this, right, there would be actin, and then there would be myosins like this, right? Myosins like this, and the second neighboring sarcomere will be there. So that's
Sir,
why.
just a question.
Bolo, bolo.
Myosin remains at its own position. It's the actin which moves on myosin, right?
That's right. That's right.
While contracting and
Correct.
relaxing.
Correct.
Okay, thank you. Thank you.
अभी तो आएगा ना इनका रोमांस आएगा.
नहीं क्योंकि वो कनेक्ट नहीं था ना मायोसिन कहीं पे, तो आई वाज जस्ट
हाँ
कंफ्यूज.
मायोसिन, यस यू आर राइट, बिकॉज मायोसिन जो है वो इट विल बी, मतलब हाथ मिला के, मतलब मायोसिन लव्स टू हग, राइट? सो उसके हाथ बनाने बाकी है. मतलब अदरवाइज पता है ये एक्टिन मायोसिन द एंटायर फिजियोलॉजी वो तो भूल ही जाओ. But then once you learn it, मतलब इसके अंदर थोड़ा नॉनवेज भी आएगा, right? But if you remember it like that ना, ठीक है यार, फिर कभी नहीं भूलते. मतलब when giving viva तो we become very sharif, right? But दिमाग में और कुछ चल रहा होता है, and it is okay, right? So this is the ये अपना पड़ोस, right? We are here and this is our पड़ोसी का sarcomere. हाँ. So actin is thin, female, myosin is muscular, thick, and then there would be the cross bridges, right? You can see these are the myosin's hand, right? These are the hands of the myosin, both the direction. So here it is one new concept. Then the concept is of refractive index. Refractive index is that when there is one refractive index, refraction means what? Bending of the light. Reflection, refraction, and diffraction. Refractive index means light ऐसे गए, and how much will it bend when it will enter into a different media, right? When it will enter into the different media. We see करे यार, wow, what an illumination, what a glow. Why it is? Because whatever the light which are falling on that object, all the lights they are coming to us. We watch so much of light. So we find that yes, it is shiny. Against that, if that substance is such कि 15 रेज इधर गए, 15 इधर गए, 25 इधर गए, 5 इधर गए, so we watch it from any of the angle. We are never getting 100% of the rays because it is having more than one refractive index, correct? So at any of the angle, only few of the rays which will be reaching to you, and that's why it would be not that shiny. Not shiny. बस इतना समझ लिया, you have understood all the concepts. कभी जिंदगी में प्रॉब्लम नहीं होगा, बस इतना ही समझना है. ऑल फिर देन तो कोई भी बोले ए बैंड आई बैंड ये कॉन्ट्रैक्ट होगा, so easy, right? Within next 5 minutes you'll understand everything. But is this concept clear to everyone?
Yes.
So,
Sir,
right?
once
more
for
बिंदास 500 बार पूछ लेना. पर अगर जो दिस फाउंडेशन इफ इट इज वीक, आगे कुछ समझ नहीं आएगा, right? Then फिर रट्टा मारते हैं. And then टीचर ने एक बार बोला कि A is bright or it is shiny or not shiny, खत्म, right? Then सोचते. Let's see this example, right? Here it is. This is glass, right? Wait, let's make it this as glass. So glass will be having some refractive index. कुछ तो refractive index जो कोई भी है. We are not entering into कौन से एंगल, जो भी एंगल, यहां से लाइट गई, दिस इज इंसिडेंट रे, एंड इट रिफ्रैक्टेड बाय सम एंगल, यहां से इतनी रिफ्रैक्ट हुई, राइट? बट दिस एंटायर थिंग विल बी हैविंग ओनली वन रिफ्रैक्टिव इंडेक्स. सो जो भी यहां से व्हाटएवर द नंबर ऑफ रेज व्हिच आर गोइंग, राइट, आफ्टर रिफ्रैक्शन ऑल ऑफ देम विल बी पैरेलल. एम आई राइट? सो फार सो गुड,
yes sir.
राइट? सो इधर से if you are watching, this is your eye, if you are watching, so then all the rays they are but they will deviate, right? All the rays they will be reaching to you because सब parallel ही आ रही है. So you will find कि हाँ बढ़िया glow, right? Yes, this is shiny. Take the second situation again. This is a glass, but this time this glass is not of it's having some minerals also, right? It is having some minerals, right? Right? है तो glassy but different. This is like a
Impure glass.
impure glass, correct? I was about to say that, right? So तीन rays ही डालते हैं, 1 2 3. This refracted at angle, but यहाँ पे तो again इसका refraction change हो गया, तो it got refracted this much. It got refracted, let's say this much. ये तो इसका तो एकदम ही कम हुआ, तो ये यहाँ पे बीच में इधर वापस रिफ्रैक्शन हुआ, इधर हुआ, और एंड देन इट इज कमिंग आउट ऑफ दिस लाइक. So now if you are watching from either this angle or from this angle, or from this angle, you're never getting 100% of the light. You're getting only partial light. So if you are getting partial over here, then it would be surely less shiny. Correct? So whenever there is more than one refractive index, things would not be that shiny, because more than one refractive index, light would scatter. But when it is one refractive index, whatever the input, all of them, they will be deviated with the same angle, and you'll be getting the perfect light on the opposite side. So that would be shiny. This shiny, okay, this shiny thing, it is called as ISO. ISO means same. ISO means same, right? So when we say isotope, right? Isotopes. So that way. So ISO, this is same. So that's why we'll call it as I. So whenever the word I comes, isotropic means same refractive index. Same refractive index means it is definitely shiny. So that's why it would be shiny. Now, where is it happening? Hold on, right? First physics, then we'll add. When it is more than one, that means it is not isotopic, right? It is not isotopic. So, यहाँ पे, this is called as and not isotropic. Isotropic was same. So just consider this as not. It is not isotropic. It is not isotropic. That means it won't be that shiny. Make sense? So that is A. When we say A, so A means that it is anisotropic. ठीक? So that is not shiny. And as such, right, this actin fibers, right, females, so they are always beautiful, very shiny, right? So this is also true. याद रखने के लिए. Males, right, they are not that shiny. So they are like, ठीक है, चलता है. Right? So this is myosin, this is actin, shiny, I band, myosin, and they will be A. Band कैसा? वो अब देखते हैं. Now we are going back to our picture. Same, जो पहले draw किया था वहीं पे. Or you can make a new one. Make a new one. बड़ा roughly बनाते हैं पहले. Just draw two lines like this. This and this. I think someone asked about your contracted state hai ya nahi, right? So we talk about that. So first parallelly, just make these Z lines. Z. So Z line से क्या attached था? Z line से attached था
Actin.
actin. Just draw actin. Right? Just draw actin. ठीक? To this actin, now in between we'll be having myosins, right? तो थोड़ा overlapping करके just draw the myosins also. But I'm adding a new page. This Z line, gracefully. Right? So these are actin,
Actin filament.
correct? And then to in between,
Myosin filament.
Myosin.
correct, myosin will be making it thick.
Sir, just one doubt about diagram.
हाँ बोलो ना.
Across two Z lines, the actin filament should be not in the same line, right? Not joined at the same point.
Means,
Like considering left side Z line that you have
Alan, you're
drawn.
talking about this portion, na?
Yeah, the
हाँ
right
हाँ
side
अभी
actin and
अभी
left
हाँ
side
हाँ
actin should be up
हाँ.
and
So
down, right?
yes, it will come. It will. So
Okay.
or you can do this. मतलब just इतना ही draw करो, इतना ही. अभी तो ये just
Okay.
समझने के लिए.
Okay.
हाँ. We'll come back to that point. अच्छा. So this is myosin. Now the question comes is this. This portion, this portion, right? ये बीच का थोड़ा भूल जाना.
H band.
This portion, forget it. This is the central portion, right? This central portion, which it will be having what? It will be having only
Only myosin.
only myosin.
Only myosin.
That's right. It is having only myosin. Perfect. Acha. What about this portion?
Both actin and myosin.
Both.
Myosin overlap.
Yes, both of them are there. And what about this part?
Only active.
Only acting, right? That's it. Now we go back to this, right? When there is only actin, so actin was what? Actin was shiny,
Yes.
right? Actin was shiny, isotropic, one refractive band, no one is there to disturb. This is neat actin, so it will be shiny. So this band, this is what is called as the I band. I band is shiny. This is the reason. Great. So this is solved. So this is done. Similarly, on the opposite side also, there is I band. So that is shiny because it is made up of actin only, and that is done. Right? Then comes this phase, which is between over here to here, in which there is mixture. Right? Actin is also there, myosin is also there. So that's why this area, that is relatively dark. It is relatively dark. Right? And then we have got this central area. This central area. This central area, this is relatively dark, so that's why this looks illuminated, or it is called as the halo. Actually, it is not. But because the surrounding is dark, so that area becomes slightly bright, slightly halo, relatively. So that's why it is called as the H zone. Right? So here, now we have understood this entire thing. This is what is called as the A band when there is mixture of both of them, right? So over here, if we really want to give the names, so now can we give this name? They gave this name, right? When we have this area, so it would be which band?
I band.
I band, right? So that is bright, done. When it is this area, so it is
A band. A band.
A band. And this in between central region, it is looking relatively, so it will be H band.
H band.
Correct, or the H zone. Right. So here it is the H zone. So now we know about the I band, we know about the H zone, we know about the A band, we know about the Z line, and we know about this sarcomere.
I don't know.
Okay. And central line, middle line, it is also called as the M line. It is like a line which is passing through this entire thing. So we know I band, we know A band, we know H zone, we know M line. On to the further things. This Z line, what we drew over here, as you rightly pointed, right, when it will be like this. This is the scientifically more correct. Right? What we drew, that was for our understanding. But otherwise, Z line, right? If one actin is over here, the second actin will be over here, third actin is over here, fourth actin is over here, right? It is not like straight line. But the point is, this Z structure, when it contracts, so that also contracts, neighbor also contracts, neighbor also contracts, the whole muscle contracts. Okay. So when the muscle contracts, forget what is written on the screen, right? When the muscle contracts, so one thing is clear, that sarcomere length shortens.
Yes. Yes, sir.
When
Yes.
so the contraction is simply like myosin is over there, right? And think it like this is the myosin. Yeah, here it is. This is the myosin, right? And these are the hands. These are the hands, right? And this is the actin. This is the actin, right? And it's holding. And when it hugs, so those actins they will come near. So this distance, right? This distance would decrease. This distance would decrease. They will come near. The entire sarcomere, right? That will be shortened, right? So it is this and this myosin, right? It has got hands on both the sides. So over here also, right, over here also, there will be another actin. But right now we are just taking one example. So these heads, they move, so it would contract, right? So what would happen? This I band was what? I band was, remember, it was shiny. I band was that band in which there was only actin.
Actin.
How to they are those that part of the actin is overlapping more on the myosin, so there'll be thin space, less space available, which will be pure actin. Am I clear?
Yes, sir.
Right?
Yes, sir.
That's the reason I band would be shortened. Right? They ask multiple such questions, right? And but it is very easy. I band will definitely shorten because now there is less. What would happen to H zone? H zone was what?
Decrease.
Only myosin.
Because now the actin is overlapping it, right, is overlapping the myosin, and so that there will be very thin space available, which is pure myosin. So that will also be decreased. What about the A band? A band.
Same.
A band will remain same because A band was what? A band was कि मेरा मैं myosin, right? Myosin will say I am to just over there. I neither contract nor expand, right? I to just pull my girlfriends. So that's what A band is doing. So it will remain
I
same.
band will be same too, right?
I band नहीं दोस्त देखो.
I-band will be zigzag when contracted position, right?
That's right. That's right. That's right. See here.
Okay, yeah. I band was only acting.
So because when it will contract, so this portion, more of this will be overlapping. It will be going near each other. So that's why this space would come near, na?
Yes, yes.
Right? So I band will shorten.
I got confused because only myosin is H zone, right? That's why.
So right. So that is how it takes. Right. So same explanation over here. So I band shortens, H zone shortens, A band remains the same because myosin, right? H zone shortens. So and Z lines they come near each other because sarcomeres they are contracting. Right. So myosin it has got the tail. It is basically a protein. So it is a tail. It has got body. It has got those arms. It has got these heads, right? And these are called as the hinges through which where the movements is going to occur. Right? So head only, it has got 4 light chains. Right now, these are the types of proteins, and these are tail, body, arms, and head. How they are same? Because it has got 2 heavy chains of protein. So structurally, that's the difference. That it is head only which has got 4 light chains, and these 4 light chains they are having the binding sites. They are having the binding sites. What type of binding site? Well, this is where it can talk to its lovely actin, right? So it will be there. That is also a point when the ATP will come, right? Obviously, ATP is what? Currency, right? So if the girlfriend is there, so money is needed, right? So that is ATP is needed. And then there is ATP as activity, right? The activity because of the ATP. So that is the ATP as activity, which will be occurring between actin and myosin at this point only. In case of right, so this was for myosin. This is for actin. Actin is just 2 chains, double helix chain, double helix, and there is one actin site for cross bridges of myosin. right? So she has got one site for the cross bridges of myosin. But in actin, right, there is one what is called as the tropomyosin molecule. Right? This tropomyosin molecule, right, why it is written as Khados? Because he will prevent meeting of actin and myosin, right? So this tropomyosin is someone who is sitting between. So then we have to play a game कि कैसे tropomyosin को busy करो, right? The way we say, अरे वो तेरा phone आया है, and then he goes, right? And then the actin and myosin can meet. हाँ ऐसा ही है, पूरी पूरी story ऐसी है. So this was the part one of our story, right? Next time we'll be having part two, which will be starting from this point, right? Plus we'll be talking many things about the muscles, their structures from the anatomical perspective. All right. So,
Yes, right.
Hi, sir.
all
Sir,
right.
I did not understand the M line point.
Yes. Which one? M line. M line is like a middle line. Middle line. As such, M line is center of sarcomere.
Okay, sir. It doesn't like we don't have to remember it's
It
getting
is just the
longer.
midline. Midline.
Okay. Okay. Sir.
Okay.
Hello, sir.
हाँ बोलो बोलो.
I did
sir.
not understand excitability.
Can you repeat?
I did not understand excitability.
Excitability is when the muscle is over there, right? Nerve is also there, right? Nerve supply is there, but then brain sends ke jao jagao usko. So that message which comes, that current which comes, and suddenly when the muscle wakes up, that is what is called as the excitability.
Okay, sir. So,
Huh?
Actually, I didn't understand the H zone. Means the H zone is only in the myosin region, right?
Correct. So
And the place where you have it in the relatively dark area, it is between myosin and actin, or the
no
whole
problem, no
myosin
problem.
and actin.
See, this is this. Let me make it slightly bigger. So this is myosin. We just write M over here, right? This is myosin,
Yes.
and so these are actin. This one, this is which band?
I band.
I.
Perfect, I band. Because remember actin, right? Actin. So actin is isosynchronous. So I band,
Isotropic.
isotropic, right? So I band. Good. This and this to the length of entire M. This one is
A.
A,
A band.
A
A
band.
band. Okay. A band, I band. Now we have got one area.
H zone.
H
This,
zone.
H.
this entire, this is H zone. Now this A band would be looking darker.
Yes.
A band
Yes.
will be
Yes.
looking darker because as such it is the M band.
It is
M band has
decreasing,
got
right?
different type of, right? And on top of it, even the actin is also coming. So when we are passing the light, so it is actin, myosin, all khichdi. So that's why this would be pretty dark.
Sir, just a doubt कि light कहाँ से आ रहा है? मतलब when we are observing it under the microscope, then it okay. Okay.
पीछे से, right? But just give me a second, right? पहले इसको खत्म कर देते हैं, then we'll talk about the light.
Yes.
So this A band will look dark simply because of it is in isotrope. right? Now this is a H zone. H zone is neat only myosin. So obviously the content is decreased now because this H zone is not having any actin. So
Yes.
that's why when we compare this area with this area, so this central area will look slightly illuminated. So that's it is not brightly illuminated, slightly illuminated. That's why we call it as halo, right? Slightly bright. So that's why it is H zone. So there'll be bright area, there'll be dark area, there'll be slightly bright area. And that's why how it looks like stripes. When we watch it under the microscope, all these things, they look like stripes. So that's why it is called as the striated muscle. Striated muscles. Fibers are
Smooth muscles have other combinations.
other combinations. Yes, smooth muscles will be having other combination. Cardiac muscles, they'll be having similar combination, but in cardiac muscles, there'll be intercalated discs.
Intercalated
So
discs.
there'll be thick discs which will be seen, and they are like windows between two walls, right? जहाँ से लेन देन चलता रहेगा. So they don't have to follow the entire circuit. Just windows में से they just communicate, and it becomes that fast, right? So
Sir, what is the zone between the region between S zone and I band called?
what is the यहाँ पे
So
देखो.
between HS zone and I band.
Between H zone, and the I band. I mean,
Yeah.
where there is this mix.
A band. Yeah.
A.
What is the name
Sir,
of
is
it?
that overlapping?
It is overlapping.
Overlapping zone, no, sir?
Overlapping zone. Yes, it is overlapping zone. I don't know. मुझे पता नहीं है कि अगर उसका कुछ नाम है या नहीं. But कुछ हुआ तो I'll find it. I'll let you know. But, I don't know. At this point तो मुझे नहीं पता. Right? But
In our studies of NEET, we were told that that is called O zone, that is overlapping zone.
overlapping zone. हाँ तो अच्छा है. मतलब yes. लिख ही देते हैं O zone. And it makes sense also, overlapping zone.
And during contraction, overlapping zone increases because actin covers the myosin most.
Correct. But over here, the most important is zone, which will be for various diseases, right? When we'll be talking about, that would be the A band and the H zone. Because it is the A band and the H zone. H zone will be deciding that how much overlap is occurring. Correct? Because it is the H zone. If H zone is becoming shorter, that means a large amount of actin and myosin are meeting. Correct? Then H zone will become small.
Yes.
So all those diseases when we'll be discussing, so they'll be based on that principle. Okay. So
Yeah, I was having one question.
bolo.
Sir, on actin filament, there is one tropomyosin filament which runs parallel to that, you said.
In actin filament?
Tropomyosin runs, na? So tropomyosin filament has troponin protein on that.
Troponin protein.
When troponin protein releases, then only active site for
that is
binding
what
of
we discussed
myosin
over. No?
occurs,
That
right?
is what we discussed. That tropomyosin molecules, they are sitting over there. So next time we'll be watching, because this in physiology, the thing what is called as the sliding mechanism, right? So that is where it will slide because of the presence of ATP. ATP is what currency. ATP will be given. It will say the tropomyosin, okay, you twist. When they twist, so all those sites, they will be open from where actin and myosin, they can really talk to each other. So paisa isko diya. So he moved, and then that meeting between actin and myosin was possible, right? So that is what this I explained in very rough language, very short. But yes, that's the thing. That's how the whole mechanism works. Very true. Right.
Okay, sir, that's it.
All
Thank
right.
you.
So next time we'll be taking the second part of it. I'm putting it into our shared folder.
So can you
Okay.
check messages? It's a very off-topic doubt, but just
Which one?
there in messages I have put.
Actually, you put it in messages. Oh,
Yeah.
so many messages. Wait. Story is full of twist. हाँ होता है. Sarcomere is structural unit of myofiber, ठीक है? And the functional unit, because sarcomere itself is increasing or decreasing. That's right. CRT, LBS secretion of calcium. Calcium will come. Calcium is someone which will be triggering this. This question is from Aryan.
Yes, sir.
Aryan. This I cannot answer in front of everyone. Okay? Email.
Okay, sir. Till your MBBS.
Yes.
Okay.
मतलब ऐसे क्वेश्चन चैट पे मत डालो, ठीक है? वो जस्ट सेंड अ मेल. दीज आर टू पर्सनल. सो क्रॉस ब्रिज खुशमी, क्रॉस ब्रिज मतलब अभी के लिए यही समझो, दीज आर द हैंड्स ऑफ मायोसिन, राइट? दीज आर द क्रॉस ब्रिजेस. ये जो है ना, this is in fact like a cross bridge. So when we'll draw something like this, like this, right? Like this. Okay. So when they contract, they pull the actin, right? Myosin is standing and it is pulling the actin, right? So these are the cross bridges.
This is like arms.
These are like arms. I'm not taking the name. अरे यार, अपनी पर्सनल चीजें यहाँ मत डालो. Send a mail ना. How can I answer these questions?
Okay, sir. Bye, sir.
Without taking
Sir,
the name, sub email them. Yes.
Sir, I have a question regarding BD Chaurasia, the books you asked us to refer to. Sir, the latest edition is having 315 pages and the older editions are having more pages. So should we refer the older one or the newer one?
One शायद ना ऐसा है. Correct me if I'm wrong. But पहले क्या था? There were three books for our regional anatomy, right? Upper limb thorax, lower limb abdomen, and head and neck and brain. Just तीन थी. And then there was one book for general anatomy. So total it was like 3+1. Now it has become 4+1.
Yes, sir.
Right? There are 4 books for these regions and 1 book for general anatomy. So that could be the reason of some discrepancy in those pages. But this is what my guess is. एक बार फिर से देखना तो पड़े, but this is what I feel.
Sir.
Yeah,
Yes.
Hello, sir.
Yes.
Sir, so if the myosin is more in the edge zone, then overlap will be less.
Myosin is
more. Then overlap will be less.
Not really, because see this myosin, this contraction, right? We just take one unit. This contraction that can keep on occurring. So it is like, it is just pulling the actin like this. So actin is actually shifting, right? So it is holding like this, then once again holding and taking, still near and still near. So that's how it really goes. So when they say that myosin remains as such, but these hands, they keep on shifting so that actin keeps on coming near and near and near, right? And that is what generates the pull. So that is what generates the power, right? And then the ability continuously keep on supplying the ATP so that it remains into that contracted state. That is the endurance. So it is like lifting the dumbbell once. So that is that contraction and then the relaxation. But when holding it continuously, so that means you are not letting it released, right? So you are constantly pumping the ATPs, And at that one point, the way it is shown in 36 chamber of Shaolin, that how much weight can you lift, it really doesn't matter. 1 kilogram of weight can weigh 50 kilogram after certain time and after certain distance. What does that mean? After certain time is that if you're doing, say, even this 100 curls with just 1 kilogram, 100 curl, you'll be shouting. You'll be shouting, right? And if you tie it with the big stick and you put the 1 kilogram over here, so it is like a mechanical disadvantage. When you lift that, right, it will weigh like 50 kilogram. So
Yes, sir.
same principles when we talk scientifically for the active myosine.
So if same will happen if it is less myosin.
Yeah, that's right.
Okay, sir.
Right, very right. Okay, so take care and see
Thank you, sir.
Bye-bye.
Thank you so much.
Bye, sir.
Bye-bye.
Thank you. Bye.
Thank you. Bye.